Good morning. I am Dr. Govini Balasubramaniam, head of the Department of Heart and Lung Transplant, Gleneagles Hospital, Fortis Network. So we have done recently a successful pediatric donor to the adult patient recipient. So normally we choose adult to adult lungs, but choosing pediatric to the adult is little challenging. Similarly, adult to the pediatric it is not possible. So in the first time we have done this pediatric to the adult lung transplant with successfully, and she got discharged on the second week itself. That is one of the fastest recovery I can say. Normally even a regular cardiac surgery, it takes almost 1 week to 10 days. In our case, being such a big surgery, she could able to get discharged within 12 days. And the importance of this case is because considering her height, she was been waiting for a longer period of time, and we could not able to get a suitable lung for a longer period. Almost she has waited for 4 to 6 months actually in Chennai. So recently we got a call from Coimbatore where there is a 13-year-old donor. So even though the size of the donor is smaller, but the lung which matches, we call it as a predicted total lung capacity we calculate, and it is almost near matching. So we have decided to go and get this lung because we have done all the assessment on donor part which was looking good, and then we have taken this lung and then we implanted her. There are certain surgical challenges which we faced intraoperatively because the matching the adult vascular vessels as well as the bronchus is really challenging. So we have applied a certain special technique in her, and we had a good outcome. So this is the first time we have done this, and probably even in India also. And in fact, even in the Western countries, they do very minimal numbers, because I can say less than 0.2% what they do it. The reason why we are highlighting this case is, even there is a pediatric donor, we cannot decline that. We can use it for someone who was in need of it actually. We get a lot of donors nowadays, and probably we have to utilize almost all the organs. So that is our motto. So considering this, we have went and this first successful pediatric donor to the adult patient. Thank you.
You said it is India's first actually, sir. On what category it is India's first?
Pediatric, because there is a 13-year-old donor. So normally what we'll do is adult to adult, regularly that we do it. But pediatric to the adult is a little challenging one. Not many people who have been expertise in doing it actually as such.
Post-operative what?
See, she had a very good recovery. Post-operatively, normally we face some challenges actually. So normally when we could not able to get a pediatric donor, we do the lobar donor. That means we take out only the lower lobe of both the donors, and then we implant. We have done that also in the same hospital. But there we will face some challenges, like we have to match that volume of the lung, because every adult needs certain volumes. So whether this is going to support her or not, we don't know actually. But we do certain specific test actually, and then we match it. If it is falls between 0.8 to 1.2, then probably we'll go ahead and do it. So in our case, it was falling around 0.8. So we did this transplant.
How was the support from the government, and how long does it take?
See, I think we had a fantastic organ donation system in Tamil Nadu. I think Tamil Nadu is the one which has created this system actually. I really thank all the chief ministers who have taken the initiative, and also the present government doing the wonderful work actually. Whether the government, the chief minister changes, but the government does a good work actually. And in fact, every part of the state in this India, they follow the same system. They copied the same system and they are following it now. So that is a kind of work Transplant is doing now. I really thank Transplant, even though they work 24/7. Even though we sleep sometimes, but they are never sleeps actually, because they have to keep constantly the work on this process.
So how long does the procedure takes?
See, it takes, the surgical part will take around 8 to 12 hours. So the whole process will take 24 hours actually.
It's a continuous one.
Surgical is 8 to 12 hours. We have to stand there and we have to do it. There is no other go. Because the ischemic time is very important. See, even sometimes when we request the airport authorities, they will give the support at the airport. Because we have to avoid the ischemic time, minimize the ischemic time. Lesser the ischemic time, better the outcomes. So every aspect, the police, the airport authorities, and then traffic police, everyone gives good support here. There is a system, robust system in Tamil Nadu, which match with the Western countries.
নমস্কার, এখানে প্রত্যেকটা ডাক্তারকে এবং মেডিকেল টিম, ফিজিওথেরাপির সবাইকে আমার অনেক অনেক ধন্যবাদ। আমি গত 7 বছর ধরে এই অক্সিজেন নিয়ে চলছিলাম। লাস্ট 2 ইয়ার্স 24 আওয়ার্স আমার অক্সিজেন সাপোর্ট ছাড়া আমি চলতে পারছিলাম না, মাঝে মাঝে অসুস্থ হয়ে পড়তাম। তারপরে এখানে আমি ডাক্তারকে দেখালাম, দেখানোর পরে এখন আমি কোনোদিনও ভাবতেও পারিনি যে আমি অক্সিজেন ছাড়া চলতে পারবো। তো এখন আমার খুব ভালো লাগছে যে আমি অক্সিজেন ছাড়া চলতে পারছি। আর তো ডোনার যে হয়েছে তাকেও আমার অনেক 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 ধন্যবাদ অন্তর থেকে। ঠিক আছে,
mentioned that we're very thankful to the donor member. So because of him, she got the life actually. So we're very thankful.
Yeah.